first thing I'd like to do is introduce my wife over here to our left. Mary has been with me throughout this whole thing. She has the same belief system I do, that wireless health. We had a company that today has about 40,000 people, so we've been front and center of the healthcare problem over the years. Every year, the amount of money that we were paying for healthcare for our employees and what they were paying kept going up, and the services they kept getting were going down. That's not a good thing. So we decided to do something about that. Now think about this. 1 year ago tonight, we didn't have a lease on this building, okay? Didn't have a lease on the building. It was a shell of a building. Everything you see tonight, every square inch of every ceiling, wall, and floor is brand new. And I think that in itself is quite a remarkable accomplishment. In our first year, we have recruited a world-class executive management team. We have also recruited an outstanding multidisciplinary team of physicians, engineers, strategists, clinicians, and researchers from every corner of the world. Generally speaking, most people who have access to health care are satisfied with the quality. You don't hear too much. The people that can go, that have a doctor, that have insurance, can get to a healthcare facility, they're not complaining about the quality. As has previously been stated tonight, we are a single-focused, laser-focused organization, and we are all about reducing the cost of healthcare, because that is what will get the people who don't have it today available and have access to it. So we're going to get at that problem a little bit different way than maybe conventional thinking, but we're going to get there. Now, if there was ever a right time for the formation of an institute like the West Wireless Health Institute and what we stand for, I believe that time is now. Because of our successful first year and obvious promise that we believe wireless health holds, as Don previously said, Mary and I are pleased to announce that we're committing another $25 million to the Institute. This money is specifically earmarked to further our internal engineering capabilities. We are going to recruit and hire world-class engineering talent who want to be part of something special. We think we can get a 2-for-1. We think we can get talented people. Our current engineering staff, who are just doing a phenomenal job right now, are not only world-class engineering people, but they have a passionate belief for what we're doing. They are good people. We can get both smart people and good people who are going to buy into this. Even though we are a medical research organization, a nonprofit in nature, we do not behave that way. We behave like a fast-starting, running startup company that has a mission and a sense of urgency about us. Every year that we go right now, our healthcare costs are getting ahead of our ability to pay for them. Nibbling around the edges of this thing isn't going to fix anything. It's just simply not going to work. There has to be some new paradigm created which is going to shift the way that healthcare is consumed, paid for, thought about, practiced, and all those kind of things. And we think, really well positioned to do that. If you think historically in this country, when it comes to solving big problems and creating thriving industries with global impact, American innovation has always risen to the challenge. It always has. You can go back in history and name everything where there's been a big problem. American innovation has stepped in. In fact, some of the best things we've ever done in this country are times where things looked really grim and bleak, and somebody stepped up and said, hell, quit talking about it, quit complaining about it, do something about it. Okay? That's what we're going to do here. And we're just not going to do that, but we want to be the catalyst for a whole bunch of people. All we can do is be a catalyst. This is a big problem and requires a lot of people to be engaged at it. Now is the time to unleash the spirit of American innovation to help reduce the cost of healthcare. If there was ever a time, this is it. We can't build enough hospitals. We can't train enough physicians. There is literally nothing in our current bag of tricks that we're aware of that is going to solve the problem. It has to be something different than what we currently have. In fact, we believe it is time for American innovation to help create a healthcare system which all Americans can afford, and West Wireless Health stands ready to lead this innovation effort. We intend to methodically break down all barriers which are now slowing or preventing the widespread adoption of wireless health solutions. Tonight, I want to briefly discuss a second major point which ties into what I have just said. Obviously, Mary and I believe It is the right time and the right place for wireless health, or we wouldn't be doing what we're doing. We've spent a lot of money because we believe in what we're doing. We're not only committed with words, we're committed with time, and we're committed with money. But there's a bigger story here tonight that I want to tell you about, okay? It's a story about San Diego. I'm going to give you a script on what I think this city ought to be thinking about and what it ought to be doing. And if we don't do this, it's a shame on us moment. I'm firmly convinced that San Diego is the right place at the right time to give birth to a new American industry. And that is going to be healthcare innovation. Healthcare innovation is what's going to get us from the problem we have today to where we need to go tomorrow. There's no other way to do it. Sooner or later, and we are going to hope that it's sooner, and we're going to make it sooner, our government is going to come to this realization, and they're going to start being engaged with us and supporting the kinds of things that we're doing. How big is that opportunity? Why should somebody even care about that? According to President Obama's recent webpage, by 2017, we will spend $4 trillion on health care. $4 trillion. There is no bigger market opportunity in the world, okay? One of the reasons that we located our institute in San Diego is because we believe that San Diego was capable of becoming the worldwide center for the next generation of healthcare innovation. All the components are here. You may not realize it, and the dots may not yet have been connected, but we're going to connect those dots. This is going to be done by combining wireless health with things like genomics, biotech, intelligent algorithms, predictive modeling and analytics, proper utilization of clinical data, wellness facilitators. Various combinations of these components and others will create a roadmap to personalized medicine. Okay, this is from the boss right here. Personalized medicine is the end game of where all medicine will go. Unless and until we get there, we are going to be fighting a cost issue. I can't articulate what personalized medicine means as well as this man is, so someday we'll get an education from him. But trust me, that's where it has to go, and we're going to drive until we get there. As was previously said, there are 300+ wireless companies here in San Diego, 600 life sciences company already based in San Diego. This community has the capacity to do something special, but as I said earlier, I'm not sure it really understands that yet. Well, now it does, and now it should. And shame on anybody in this community that does not look at this, okay? Now, what do? We should take advantage of this unique moment in time. I'm talking about all of us in this room and everybody in this community. And there are a lot of influential people with us here tonight, and I thank you for that. There are people in the media, there are people in business, there are people in different aspects of trying to grow the community. As medicine, engineering, and science converge, we should integrate their collective power to create a new transformative model of healthcare. Right now, San Diego has a once-in-a-lifetime opportunity that every community would love to have, okay? That is the legitimate opportunity to become the global center of healthcare innovation. This is not rocket science, okay? Everybody says, ooh, boy, that sounds complicated. It's not complicated. It really isn't. The first thing you do is you start saying it. Because right now, I don't think there is any place other than San Diego that could make, as small as it may be, we're the best game there is in town, okay? So when you talk about San Diego, you start talking about San Diego being the global center of healthcare innovation. Our newspapers should write about it. Our publications should write about it. You people should talk about it. It should be said over and over and over again. And you know why? Because once we start saying it and people look at it and start vetting us, they're going to start saying it. Pretty soon, it's going to be on the evening news. It's going to be in the Wall Street Journal. It's going to be in all these kind of places, okay? And pretty soon, if it gets said enough, it just becomes true. Well, now, but we're going to do better than that. The next thing that you do, once you get the buzz going, is that we do things which validate our statement. What is that? That means we go out and we actually create products and solutions which reduce the cost of health care. Once 2 or 3 of those happen, they get in the press. All of a sudden, yeah, look at San Diego, the global center of healthcare reduction in costs, look what they're doing. They just ripped $3 billion out of the system here. They took $7 billion out here. Pretty soon, a few billion adds up to be a lot of money, right? We're gonna do that. The West Health Institute and other fine companies which are now working in San Diego, some of which are in the room right next door, and like Don said, please go visit these people, are going to initially drive the process, the people that are engaged right now, but we want to bring other people into the fold. And that's the reason everything I said before that. We start talking about it, we lay claim, we put the stake in the ground, that's what we are. Pretty soon, other people start looking at that, they hear the buzz, and all of a sudden, that attracts entrepreneurs because smart people want to be around other smart people. And if something is happening in an area which you're interested in being in, guess what? If you can start a business anywhere you want, you're going to start a business where there's a bunch of other people that can help you get to where you want to go. San Diego is the catalyst for that whole sort of thing. Next thing you know is you get a bunch of entrepreneurs wanting to come here. Guess who follows them? Money. The venture capital guys follow them, right? It's the way the world works. Without venture capital money, the whole thing doesn't go anywhere. So we need the entrepreneurs, we need the buzz, they'll bring in the venture capital money, and all of a sudden you've birthed an industry here in San Diego. And guess what? San Diego then becomes the undisputed global center of healthcare innovation. This is not a fairy tale. This is something that some city is going to lay claim to healthcare innovation. And I want to tell you something. When I say healthcare innovation, I want you to understand that I can put the words cost-effective in front of that 100% of the time. Anybody, this is my best advice to people out there developing products and solutions for today's marketplace. If it's not cheaper than what's now being done, save your time, save your energy, save your money, because nobody's buying it. CMS isn't paying for it. Healthcare systems aren't paying for it. Insurance aren't paying. It doesn't matter. I don't care if it's 5 times better. If it's not more cost effective, they're not buying it. Right now, if it's as good as what it was before and it's cheaper, that's what the world wants to buy. I'm not even telling you it's what I like. I'm telling you we've done a deep dive. That's the paradigm within which we are working, and I just want to share that with everybody so everybody's on the right page and gets off to the right start on things. Now, I originally was going to tell people that there's new technologies to look at, but my notes here say Don Casey has a few closing remarks. So anyway, thank you very much for joining us. I never get the last word.
I'd actually like one last time to I would like to, on behalf of all the Institute employees, Gary and Mary, we'd just like to thank you guys so much for your passion, your vision, and just the extraordinary opportunity you've given all of us, point one, but most importantly, we had a great moment in our strategic plan the other day. We said, look, if one of our products saves the lives of one patient, it would be worth it. If one of our products is able to be transformative around the world, which would allow another 100,000 people to get health care, it would be worth it. And it's not often that you find people that would try and enable this where there's going to be virtually no benefit to themselves. So I think it talks to your passion, commitment, and courage. And on behalf of the Institute, and Mayor, I'm going to give this to you. Thank you very much.